Right now.
Wildfire smoke comes with a number of hazardous ingredients, and it's dangerous for everybody, especially if you're older, if you have some breathing conditions or heart disease. Joining us this morning with some tips to stay safe, Dr. Clifford Basset. He's the medical director at Allergy and Asthma Care of New York, professor at NYU Grossman School of Medicine. Dr. Professor, nice to have you back on Good Day New York. Are you seeing an uptick in your practice over the last few days?
Definitely. A lot of phone calls from people that have allergies, sinus, and asthma. Asthma is treatable. It's controllable. We shouldn't have people running to urgent care or ER because their respiratory system is going down.
So what should they do?
Pay attention to the weather reports. We've been watching Mike Wood, as we talked about, for decades. Listen to the pollen count. Pollen season's still here. Tree pollen, grass pollen. So you got a predisposition, and if you have asthma, work with your doctor, see an allergist, find out how to treat that condition. And of course, air pollution, it's the same as you said earlier. Cigarettes, it's like smoking 5 to 7 cigarettes without the nicotine, and that's not going to be good for your airways. What's unique about these Canadian firefighters is the small size. The particulates are less than 2.5 microns. What does that mean? Deeper and deeper into your lung passages. So a healthy individual, and I see these this week, go running, they're working outside, they're running around, they don't need to do the running in Central Park today, as some of the tourists said. However, when they do it, the airways are affected because you have these small particle size, the particulates, other gases that get into the deep areas of the lung, and that can compromise lung function, and you may feel a little chest tightness, this and that. Don't want to walk the dog. So just take the extra step, drink water. Water can cleanse the body of toxins that can be present in gas. Again, it's polluted gas. There's some man-made structures along the way that may have caught fire. So all of these things can be managed with the mask. As you see, I brought in my N95 mask, which gives us the most protection in our medical practice. We're very geared on this in healthcare.
Let me ask you, though, because you're talking about the KN95 mask. One of our reporters is out in Central Park who spoke to a runner and said, I can't wear those masks while I'm running because I can't breathe, which also constricts your breathing, which also makes your chest feel a little bit tight.
Look what he got. He brought a whole menagerie, everything that you need in masks.
Well, I brought you guys the pink masks, which these are level 3 surgical masks. This is the KN95. Many people find they get a good fit, provides a higher level of protection, and then of course oversees the KF94 masks.
I haven't heard of
but
that
for
one.
me in the practice, I stay with the tried and true. It gives me the most protection, and I also protect my patients who may be vulnerable. So again, the vulnerable people, they know who they are. They need to speak with their doctor, and I think we're doing a great job coming together. The governor's done a fabulous job providing 1 million masks in our area and throughout the state. That's fantastic because people have thrown their masks away. We give patients, when we feel it's appropriate in our office, to wear a mask, and everyone says, I threw them away, like you said.
I know.
That's not so uncommon.
Well,
Take the necessary measures, get through it, and the good news, by midnight tonight, it's going to start to ease off, and some of the warnings will go down because our AQI, or air quality index, was one of the highest it's been in many areas, not just in New York, Midwest, Mid-Atlantic, so it affects about 100 million people. And as an allergist and asthma specialist, I get upset when I see people suffering. So take the necessary step to take care of yourself and your family.
What about the delayed and potentially deadly effects down the road, years from now, that we can see? Do you see any of that happening?
Let me start positive. The good news is it's short-lived. We had people suffering, many people in California in the last year or so with firefighters that went on for days and months. This is a relatively short period of time, so we should be okay. Certainly there's always long-term effects when you're exposed to toxins and pollution and firefighters. And firefighters are some of the worst pollutants because of the small particulates, but we'll get through this.
So I'm wondering, I know we talked about wearing the mask, but eyes, I mean, my eyes have been very irritated over the last few days. What can we do?
Just like for the pollen sufferers, I have them wear big sunglasses, wear a hat. You're going to catch a lot of smoke, pollen in your hair. Same with your eyes. By wearing glasses, sunglasses, you take an extra step of a barrier, and you'll get through it. Again, some people may use artificial tears. They may have dry eyes. And for those people, they may need to see their ophthalmologist or an exam. And again, we're getting through this well. It's a short-lived period of time, but it's something that we're not accustomed to. So I think we're all taking a breath of relief. That relief is coming, and I think that's the best news I could say. But I think we're getting through it, and I think people are listening to Mayor Adams, who's a leader, and he's trying, with his health commissioner, Dr. Vajan, they're giving really good tips about what people could be doing and providing resources to help them do that.
Is there a warning sign that that you really should take more serious attention to this matter?
Well, overseas in Asia, even decades before we had COVID, people wearing masks. They were taking steps. I know in my office we have HEPA air filters in the ceiling. We have them in individual rooms, and we've had excellent air quality. In fact, when the air conditioner guy comes, he goes, are you sure you're in New York City? So we try and provide clean air. Remember, it's fundamental. Water, air, good food, nutrition. This is how we live longer and hopefully live healthier.
All right, I like that. Clean air? What are we doing over here?
I'm not sure. New York City, clean air, but those of us who lived through the 80s.
It's much cleaner.
I mean,
It was much cleaner in the 80s. I thought it was worse.
What I'm saying is they've made major strides in getting the air quality index below 100 most days.
Right.
And that's the key. Weather conditions will affect us, but I think we're really on a better page now. We're very aware of weather. We have apps now. Oh, by the way, airnow.gov. You can put the app on your phone. It'll give you the air quality anywhere you go in the country, specifically New York City. And the numbers were high, but they are coming down.
Dr. Clifford Basset, where can people find you?
Well, I'm an allergy and asthma care of New York. I'm an allergist, immunologist. We take care of family members that have allergies and allergic conditions, including asthma. So we'll be there answering questions for our patients. So I have a lot of them.
Yeah.
How does it apply to me if I have a child? Talk to your pediatrician, talk to your respiratory physicians. And the great doctors and nurses and healthcare practitioners are going through this. We're getting busy, not just in our offices, but throughout the city, urgent care and so forth. And we can get through this. The tasks we have are relatively simple. It's a short-lived problem, but I think it's something we've not accustomed to before.
We're not. Thank you, Dr. Basset.
My pleasure. Thanks for having me.
Wait, do I get my pink mask?
Oh, yeah. Bianca needs a mask.
Thank you.
Thank you.
Appreciate it.